Emphasis there on social distancing as they whisper. Very impactful story there by Timothy Otieno. Now, Health Cabinet Secretary Mutahi Kagwe is expected to appear before the National Assembly Health Committee tomorrow to answer to audit queries in the ministry. Questions have been raised over the ministry's handling of Covid-19 funds. And as Shadrach Miti now reports, the committee is also seeking answers on the whereabouts of recent testing kits donated by philanthropist Jack Ma.
As cases of the deadly coronavirus disease continue to sour, so has the scrutiny of the health ministry risen, particularly following recent reports that the ministry might have spent a whopping 48 million Kenya shillings on airtime, tea and hiring of ambulance services.
It is always good to put things in perspective so that when you put a figure, it is a figure, and to ask yourself, is this a figure for a month? Is this a figure for 6 months? You know, how much time are we talking about?
Pesa yote ambaye imetumika kupambana na hii jangwa, wakati ukifika, it shall be audited in broad daylight.
And now, Cabinet Secretary Mutahi Kagwe gets on the hot seat on Monday as the Murang'a Woman Representative Sabina Chege-led National Assembly Health Committee grills him on the funds and queries on the ministry's accountability for recent COVID-19 related donations, including testing kits donated by philanthropist Jack Ma.
The issue of the donations, not only from Jack Ma, but even from other development partners, whom some of them have opted to actually even do the procurement themselves, would be asking the minister to finance us with a clear detail on what has been received.
Chege had recently toured the Mbagathi COVID-19 Isolation Center, and her observations there, including growing fears over stigmatization of quarantined persons, is also expected to confront Kagwe as the committee inquires on the ministry's counter-stigmatization strategy during and after the pandemic. In addition, the CS will be called upon to explain the criteria used in the purchase and distribution of medical equipment for combating COVID-19.
The Health Committee is seeking to know how the money, the 1 billion Kenya shilling, was spent. We had asked not just only for that World Bank money, but also for what the government has given. We also approved a lot of money at the supplementary budget, and our concern is how that money is going to be used.
Sometimes what happens, the businessmen, the so-called businessmen, those who have no idea about technology, they're very rush how to convince the governance and sell this product so that they make money in between.
The committee insists the session will be a physical meeting, but will adhere to the ministry's directive on social distancing.
We only have 9 members coming, and the minister also comes with will come with very few members. Virtual meeting, we tried it last week, it worked well, but sometimes the disadvantage of virtual meeting is when we might need to clarify something or a document to be tabled, then becomes a little bit hard for the documents to be given on time so that we can scrutinize them. That's why this time we want to have a physical meeting, but we'll adhere to all the guidelines by the public health to keep social distancing.
The summoning of Mutahi Kagwe is expected to put to rest the many questions being raised on the government's expenditure of 1.3 billion shillings. The CS will particularly be called upon to give a breakdown on the itemized budget for funds given by the World Bank. Shadrach Miti, KTN News.
Well, a quick correction there. It is the National Assembly Health Committee that has summoned the CS Health Mutahi Kagwe and not the Senate. Apologies for that problem. Of course, that particular session